to use data. Brilliant. Okay, I'm going to let you have these slides as well, so feel free to take notes, but everything you need is in these slides. So what we've done is we've put together this presentation based on real life cases that I've worked on with clients. So we're looking at some different ways that funders ask questions around impact and how you answer them. But what we're going to do is a kind of hybrid fundraising and impact evaluation presentation, because we're going to show you also how to collect really good quality data in order to be able to do evaluation as well and make sure that your bids are as well evidenced as they can be. Okay, so this is all based on real life, okay? So it's how to talk to funders about impact, and it is deliberately been put together so it's nice and fun. And because this can be a really arid, quite dry subject, but what I make sure that actually it's kind of a bit more accessible. So what's the plan? So we're going to give you a very brief introduction to evaluation, because if you're going to talk about impact, you need to know what that means in terms of your own organization. We'll look at what funders ask. And what I want to make sure is that you've got the right type of data to answer the questions. And there are different types of data you can get out of an evaluation. So when you talk about impact, it's often quite contextualized in terms of the different types of data or information you can get out of an evaluation. So I want to make sure that you're able to use the data in the right way. We're not going to do this because this is for the longer presentation. We're going to cut this down so it's only 2 hours. Instead of activities, we're going to ask some questions. So what we'll look at is what are funders really asking when they ask about impact, how to answer those questions. So that's how to talk about it. So if you have data, how to present that in its best way, and then how to get the impact data that you need. This is basically, I mean, I've written this primarily for organizations which deliver something to a group of beneficiaries, like a service or a program. And so it has quite it's quite applicable to other situations. But if you want, for instance, to make a funding application for a capital grant, like a building or something like that, this tends to be less useful for that, although there are some lessons. But this is for program deliverers more, in most instances. So what we've got is some additional support. So I've got a website, and on that website are some free how-to guides, which I'll send you links for as well when we send out the slides. You can also have an hour's face-to-face free consultancy. So you go to Beverly, and she will help broker that by my email. I'll talk to you about this at the end. We've got a low bono impact consultancy offer, just so that you don't have to pay commercial rates for this work, which I just guarantee, you know, not many charities can afford 750 quid a day. So we just do it for a flat fee. That's the website, but I'll send you everything in all this in a kind of follow-up email where you can have the slides as well. So what's next? So let's explore this through a case study. And I've put this case study together so that we can go through a fictional CEO's thinking about how she does this in practice, so that you can kind of get some sort of, it just brings it to life and makes it a little bit more kind of practical and what we're trying to get you to think about. So with this case study, we've got a charity that's done an evaluation, it's got lots of data and wants to use it. And when you do an evaluation, there's only 2 reasons really. The business case for it is either to have data to put into a bid, or to have data to get you to do something better, you know, deliver better quality or better, more effective programs. So this is data which isn't just for an impact report that you go onto your website, because that's quite expensive. It's data that you're going to use as an organization. And I call that operationally useful data. So let's look at some funder questions. And these are all from organizations like Henry Smith, Alan Lane, John Ellerman, all these big lottery. Okay, so you'll recognize these. And these are impact questions. Okay, so they might ask, and I put in bold, I've put the kind of operative word. Okay, so please provide outcomes evidence from either the work you or others have done to demonstrate that what you do is effective. How do you monitor and evaluate the work we're delivering? What outcomes do you hope to achieve that demonstrate that you're basically any good at what you say you're doing? What difference does your project make? You can see some of these are more or less kind of broad, and some of them are more or less generalizable. Please explain how you collate, measure, and report the benefits you describe. And, you know, what difference do you make? How do you measure success? And you can see on and on, they've got these kind of keywords coming up: outcomes, aims and objectives, impact, benefits and outcomes. Okay, and when I send the slides around, you can look at these. But you can see there's different ways of asking about impact. And usually I'll say also you've only got 250 words to do it in. So that's why I write the bids for my clients, because quite frankly, it's a bit of a skill. So here's some typical funder questions. And there's another one, please give 3 main questions, differences or outcomes you want to achieve. So not all of them are asking for data. They're asking for you to describe the processes that you use. And that's really key, because you don't have to have done an evaluation. What you have to do is have some, thinking and clarified thinking in place to say, actually, this is what we measure. So you'll see this now. Okay. So let's look at our case study. So hello, Mary. Mary's our fictional CEO of our fictional youth employability charity. There we go. And we're going to her thought processes. So we're going to look at what Mary does, okay, to be able to answer those impact questions. And I do it this way just because it just, it's just a less boring way of doing it, to be perfectly honest. So we'll look at what she does online, okay. And this is a little bit about her charity, just so we can put it into some context. You can see it's in a lovely area of North London, probably. Okay, youth employability. So they've got 4 staff and 10 volunteers, right? So I've set this up so some really interesting challenges come out for the organisation. Delivers a grant-funded youth employability programme, and let's say she's got 3 funders. 2 of those could be grant, 1 of those could be a commission or some corporate. She works with vulnerable young people. So you all work with vulnerable people because you're charities, okay? But these are young people. There's some safeguarding issues around working with them in an evaluation context, and it's community-based. So it's quite an informal setting that they're delivering in, and it's through workers and key workers and volunteers. Big on safeguarding and research ethics, as you'd expect, because they're vulnerable young people. And what it means is they're going to make it very much on voluntary consent, informed consent, and the young person's at the heart of the evaluation. The vulnerability is key, because if they're so vulnerable, I work for Age UK, one of my clients, we don't evaluate very vulnerable older people just because it's just not fair. Okay, so we'll look at other ways of getting data around. In this case, let's imagine that she's right at the start of this process, and right, she's basically what I call not being evaluation ready. She's got nothing to measure. She's got no data, she's got nothing to measure, and she's got no tools to collect the data with. So we're going to go through the very beginning of the process. And that's relevant for how the funders are going to ask the questions about impact. So let's see how Mary's answered these. Okay, so I'm just going to go through 4 things first you need to know preliminary to doing anything about evaluation. 1, okay, there's an evaluation cycle. Okay, so whenever you do an evaluation, you start off with what are we already collecting and audit, developing some measures, developing some tools. I'm just going to admit Gabrielle. Hi, Gabrielle. You haven't missed much. We're just starting. Develop your tools. That could be the survey. Do some sampling. If you're a big charity, Age UK works with 26,000 people. I'm not going to give them all a survey. I'll be there all day. So what we'll do, we'll decide who's going to get the survey. Data collection, so you administer your survey, then you do your analysis, and this is the bit I would do, you, and then I'll do your report. Okay, there's an evaluation cycle. Why that's important is because funders, even if they don't know it, and they probably don't, I'll come back to that in a minute, all their questions map onto that cycle. So some of the questions are about outcomes. What outcomes do you report? Some of them about how do you collect data? So through a survey, through focus groups, qualitative or quantitative methodologies and stuff like that. And I'll show you what those mean in a minute. Sampling, they probably don't ask about that, but you can tell them. How do you monitor your outcomes? They'll ask about that. And then they'll ask about, what have you achieved success-wise? So you've got this evaluation cycle, and you've also got different questions that funders ask against it, right? So you've got questions about what you measure, questions about how you collect data, questions about impact, and questions about what successes you've achieved. Okay, this is how we're going to basically structure this presentation. We're going to do it in 3 ways. So I'm going to basically bring all 3 together because they kind of overlap. I want to make it really simple for you. And I said funders might not know this. I'm just working on an assumption funders, just for safety, actually do understand a bit about impact. Some of them do. The Big Lottery, big on it. City Bridge, if you're a London funder, they really do understand impact. Okay, so they've got teams of people who will do this and look at your bid. But Dulverton Trust, they just meet quarterly and like good ideas, and they aren't interested in impact. Certainly they weren't last time I spoke to them about it. So it's just, I think, you have to know the funder, and you'll know So one of the things that Bid Rotary have turned down lots of people recently on is not being able to show that there's service, that participants have been involved in the design of the service. They're really big on that. So in your evaluation frameworks, you might want to have a participation theme as well and show how you can do that. But yeah, so different funders probably take a different view to this. I'm gonna work on the assumption that the better evidence bid is the one that's going to be more successful. Okay, it's not unsafe, but it might just be that you do more work than you need to. But then talk to the account manager, and you'll be able to find out from the funder. So the first important thing is a funders questions map or ask about different stages of the evaluation cycle. So it's good to have an evaluation strategy so you can make sure you've got data to ask those. We'll look at how Mary does that. Then the second important thing, there are different types of data. I've alluded to this very quickly. So when you do an evaluation, and some of you will already have done this, you can get 3 different types of information out of your service users. Do they like what you do is one, that's your satisfaction questions, that's engagement data. Did it work, which is impact data, and did you do it, which is your delivery data. Now, charities are really good at delivery data because the contracts often specify it anyway. And charities are very good at asking their service users whether they like the service, because if they don't understand impact, that's what they'll ask as a kind of default. So you've got these 2 different types of data, which you're very comfortable working with. And I'm making blanket assertions here, but basically my best practice, but what I understand, it's kind of common. But you know, if you are talking about impact, and that's brilliant, well done. Okay, but there's this impact bit. So the whole point about the work I do with organizations is to fill in the gap, is to get them to talk about impacts, the difference that they're actually making to people in the service better, and then to be able to report that against these different types of data and not over rely on talking about engagement and how lovely the service users think you are when it comes to answering impact questions. Because I get the feeling that some funders will spot it a million miles away and know that you haven't got a very good evidence base. But some might not, that's the thing. So we have to be careful about how we look at that. What you've got is these 3 different types of, they tell us different things. So impact, when I look to those questions about outcomes, when you talk about impact, what you're doing is talking about outcomes for your program. When you're talking about deliverables, you're talking about the delivery of the program, the outputs of the program, what you've done. And forget inputs for today. If any of you have heard about the theory of change, you might need to know something about the inputs to your service. It's things that make your charity the strong charity it is. And it's things like high levels of user satisfaction. That's an input, which is why satisfaction can be quite important, but it's not impact data. So what we're trying to do is kind of make sure that people understand the difference between these, what they do, and then how we can basically help you to do better outcomes reporting around impact. So just a bit about that. You've got these different ways of talking about data, outputs of the deliverables of the service, and the outcomes of the objectives for the service. Okay, so all you need to know. So why do you need to know that? They tell us different things. Okay, inputs tell us about the satisfaction, about the strengths of your work. Outcomes tell us about impact, and outputs tell us about what you did. Right? That's draw a line under that now. So what I want to show you is how some bad practice creeps in if you don't understand that difference. So here's some things that you must never do. And this is a real life example from a client. Mary has been confusing her data types. Okay, so the funder will say, tell us about your impact. And then she says, well, we've reached 100 young people and delivered 10 employability workshops, which is great. But what they've done is answered an impact question with delivery data. And here's another example. Tell us about your impact. And then the service user, Mary, says, 97% of our service users tell us they would recommend us to their friends. Right? So don't do that. I would reiterate, don't do that, because I think that funders don't find it helpful. To actually, what they're working for is actually the impact side of things. So this is the sort of practice that we're trying to kind of get rid of by clarifying that middle bit of what is impact and how to measure it, and how to talk about it. So that's a business case, okay? So let's look at, I'm just going to slip through these because these are for the longer version, but these are examples of outputs, number of young people in the project, number of workshops delivered, mentoring sessions held, for instance. These are example outcomes, skills development. They're getting better at doing something. Development of self-confidence. If you're measuring self-confidence, they're becoming more confident. Increased well-being, okay? So if you want us to talk about impact, this is what you kind of need to start capturing, which is why we need outcomes. So let's go. So the second important thing is when funders ask about impact, it's beneficiary change they want to know, okay, not delivery. So there's a third important thing. I've talked about this. The main reason for doing the valuations is either to give evidence into funding bids or to do stuff better by delivering better programs. And then there's comms and there's marketing, secondary reasons. But the main reason you spend money on it, okay, is to do the bids and to do better performance management. Not just to have a glossy report that you can sort of show to people, because it's hit and miss whether it actually makes a difference to your work. So, and then the fourth important thing, okay, this is quite important. Fundraising and evaluation work together to support business planning. So if you have a business plan that says what you're going to do over the next 3 years, right, or whatever time frame you've got, that might be scaling up on new services. Fundraising strategies make sure you've got the money there when you need it over that development cycle, okay, and you've got a pipeline 6 months in advance. Evaluation strategies, this is what we're going to talk about with Mary, make sure you've got the data when you put your bids in to be able to evidence the work that you do, okay? So and that shows you that you're investable to the funder, right? So that is why we do this work, because it supports all these other areas of business development, okay? So the challenge for Mary is that she needs to know a little bit about impact measurement. She can't talk about it unless she knows what it is and what it means for her organization. She needs to know how to collect data because the funder's asking it. And she needs to know how to write about impact in reporting because the funder's also asking about it. So you've got the cycle: develop measures, data collection, and reporting. She needs to know how to do those things in order to be able to write those bids better. And this is what we're going to show you to do. Before we do that, there's a bit of an overlap in terminology around impact, which is often confusing, but it's easy to sort of get rid of. So data, that's the information you collect, very general. Outcome, that's what you want to achieve, right? Output, that's something you've done. Input, things that make your charity tick. We'll ignore those now. We're not going to come back to that. A measure, because you saw that in the questions, that's an indication of the change you've made or want to make. Monitoring, that's just the process of collecting basic data. And if you run a CRM, that's what goes on the CRM, okay? Like if you're using charity log, for instance. Effectiveness, again, how good your service is, and impact, the difference you've made, right? Thing here is impact, effectiveness, measure, and outcome basically are interchangeable. They can be sloppily used, as you saw in this question. So they are the same thing. You talk about outcomes, you talk about effectiveness and about impact. They're pretty much doing the same thing. You can nuance them, but for this, I don't think you necessarily need to worry. I've got a question. Yeah, someone's got their can everyone go on mute? Because I think there's someone, I can hear someone also, some static in the background.
I have actually put in the chat bar to who it is, if they could just mute.
Okay. Brilliant. Okay, well, I can proceed. So so we need
Jason, sorry, just to also let you know, there is a little bit of cutout. It's not so bad that I can't hear. I've just asked everybody else that they can hear. It is, just sometimes the broadband's blurring a bit. Okay.
Well, so I'm not on fiber, you see. So anyway, let's push on. If it gets too bad, let me know. All right. Okay. So remember that Mary needs to know 3 things: impact measurement, how to collect data, and how to report it. So what does she need to know about measuring impacts? Well, these are the questions that the funder was asking about measures, remember? So they're asking questions on that outcome cycle about what outcomes do you report. So they were asking other questions, but we're going to focus on that first one. What outcomes do you report? Okay. So these are the questions funders ask about measures. So what outcomes do you hope to achieve? What difference will your project make? Please describe your overall aims and objectives, benefits and outcomes. So in that big list, what 3 main differences or outcomes do you want to achieve? Okay. So it's not asking for data, not saying tell us last year's evaluation results. What it's saying is actually talk to us about what you do, what processes you've got. And we're going to assume that these are written specifically with that in mind, rather than the funder just basically doesn't understand it even. Okay, or they might not. So to answer these, Mary needs to have a coherent set of outcomes that she can talk about. All right. So how does she get that? She gets that through I'm not going to read that out because it's got to come out. So let's look at how Mary develops her outcomes. Right, developing outcomes measures. Right, so the important thing here is she now understands the difference between an output and an outcome, right? So she can talk about it a bit more coherently within her team. But she needs some outcomes to talk about. Now, she's got these, but she needs to have them in a single place because she needs to talk about them consistently to all the funders at the same time. And this is how she develops them. Mary, in this case, is me, because this is how I work with my clients. So any charity that I've ever worked with, and I probably include all the charities here, are already talking at various places and in various ways about the difference that you want to make. Okay. You might not be doing it particularly, coherently. It might be just, it looks slightly different whenever you write about it, but there's going to be a set of documents that say, this is what we do, this is the difference we want to make. Okay, what we need to do is work with that first. So this is where we audit. And the reason that you want to do an audit first, or at least Mary does, is if you're writing funding bids and you're already telling funders what you're going to achieve through the funding, then there's a commitment to report on that. So the first thing is, let's make sure you've got the data to actually do what you've said you're going to do to existing funders and work back from that. So what she does, and she being me, is I look at all of your funding bids. So when I was commissioned for my last piece of work, which was a life skills education up in Nottingham, doing resilience training for drugs to young people, I said, send me all your funding bids and your program plans. And this is what they sent. So they sent, hello, we'd like £30,000 for our amazing program. We'd like £60,000 for a brilliant program. I have seen bids like that. So she looks at the existing program and funding applications, and she basically takes out all of the bits saying this is the impact that we want to make or expect to make with the money that you're going to give us. And it gives her the following outcomes that she, in this case, I put these on a piece of old card and I've stuck them to the wall so you can all see her outcomes. So just by doing that audit of existing documents where she's already telling funders what she wants to do and what the difference she's going to make with their money, these are her outcomes. So remember, she's a youth employability charity in this example. So creativity, she wants people to come out with better communication skills, more confident, more resilient, be able to plan and problem solve as you'd expect for a youth employability program. Yeah, be able to sort of manage workplace relationships and become leaders. Okay, so these are the outcomes that she's already telling her funders she's working about. So what she does is she then looks at them and think, okay, let's just sense check these and make sure we haven't missed something important. And if you're going to do the big lottery bid, this is where they love that sort of thing. She basically goes to the young people that she's working with and does a bit of participation work to say, okay, what are the ways you'd benefit from coming here? And they'd say all of the things that she's already put in her work, in her outcomes, right? So they'd say, well, we'd expect to get better communication skills, be able to sort of, manage relationships in the workplace, whatever. But the one thing she'd missed, which is why she wants to go back to the young people, is they also said, well, we'd expect to have better workplace well-being because we're very anxious about going into the workplace. We'd expect you to be able to sort of help manage that process for us as well. So by doing that participation work, she's then got these 7 outcomes rather than 6. How does she use those, right? So she can start to answer the questions. Now she's just got those outcomes. She doesn't need to do anything with it. Those outcomes would have been, maybe she sent around the organization and did some kind of, internal consultation, but she's got what she needs now to start answering these questions. So they ask, what outcomes do you hope to achieve with this funding to demonstrate that you'll be addressing the priorities you've identified? That's one of the questions we'll use as an example. And then she says, well, she knows it's an outcome question, not a results or evidence question. Not saying give us any data, just what are your outcomes? And she can tell the difference between an output and an outcome now, which is really helpful. She can think about the different types of data that she's got available to her. So satisfaction data, delivery data, and impact. And she knows that she's got to talk about the impact side of things. And she knows that they want to know about outcomes. Specifically, what that means is they want to know about impact. So just going through that background bit, that preliminary, she's really in a better position now to answer this question. So we tell them, or Mary tells them, what we measure impact against, which outcomes for that program or for that bid, what the measures tell us. So she might say, she'll unpack it. We measure confidence because we measure planning and program problem solving, because that's a really important workplace skill. And we understand that young people we work with don't come from particularly work ready households where we've got strict people to tell them this. How each outcome makes a difference to service users. So by building confidence in young people, we're able to do this for them. So she's developing a narrative just against the different outcomes. And then this is her answer, right? So through our employability program, youth employability measures young people's work readiness in 7 outcome areas by building young people's ability to communicate effectively, have the confidence, they're in red because that's the outcomes in her framework, to use the skills in the workplace and to see themselves as problem solvers. Our programs enable young people to make a significant contribution to the workplace. Through interactive workshops, we encourage a creative approach to problem solving and for young people to take the lead for developing workplace relationships. And then she might say, by building in ongoing pastoral support, which is always a bit that charities find difficult to bring into to evaluate, into our programs, we prepare young people to cope with career downturns, resilience, and maintain their career focus over the long term, avoiding negative impacts in their well-being by enabling them to deal positively challenging workplace experiences. And that, just by having those outcomes in place and have been doing a bit of thinking about, what is it that this organisation measures its success against, you've got everything you need to answer those first stage questions. Okay, so at this point, this is where we usually go into an activity, but what I want to do instead, because we're keeping this quite short, is, has anyone got any questions at this point in terms of how this might apply to their work? Because if not, we can talk about method and data collection next, which is very exciting, but it gets a little bit complicated at this point. Karen, yeah.
I've always had a slight concern about measuring satisfaction levels, because they're sometimes called happiness sheets, and people say what you would like them to say, and it is a very it's very difficult to quantify actually the impact or outcomes if it's about feelings. Are there more areas that you can recommend? Because if I were at the other side of the bench, if you like, I'm always very cautious about satisfaction levels, happiness levels, well-being, things like that.
Well, well-being you can ask. That's slightly different from satisfaction. I'll show you how to do that. With satisfaction, okay, so look, the biggest indicator of whether your service users are satisfied is whether they actually come back to the service. Okay, so when you do your registration, if you've got, let's say Mary's running a 10-week program, okay, and in 5 weeks, in week 5, only half the people are there, right? That's telling us something. That's called attrition data. So people are not coming into the program. So that's telling her something already. She doesn't know what, but it certainly means that it might be an indication that they actually just don't like coming. Okay, that's why we do what we call process evaluations, when we look at the barriers and challenges for service users engaging with programs. So what are the barriers and challenges for you coming here? Well, they might say, I don't like the volunteers, or I don't like the setting, I don't like this building, or this is a real life case with Action for Children when I worked there, they weren't coming to an anti-gun and knife crime intervention because stupidly we put it in the wrong postcode where another gang was active and they couldn't get there because they weren't safe on the bus. Okay, so people not coming, even if you look at your registration data, tells you something. So you don't need really, because if you do satisfaction questions, you're only talking to the people who are there anyway, and you can assume that they're getting something out of it. So I wouldn't even bother to ask that question. The most important thing is why people don't come, not why people do. And you can do a bit of feedback around that, but do it perhaps a bit better. Well-being, we'll see that you can measure well-being quite effectively, if you do it in the right way. Okay. So if we
really what you're doing is you're correlating output measures with the outcome measures.
For satisfaction, you are, because so yeah, I mean, when you do your registration data, it does fall into that kind of delivery data, because you've got to count the people you're delivering to. It's quite quantifiable. But yeah, I mean, if over the period of the weeks that you're running your service, people just don't come back, that satisfaction indicator data better than anything that you could ask. And don't ask it because it's just a waste of time. Because basically, instead of asking that, you can ask 10 loads of other really interesting questions, which do tell you something. And the idea is to keep surveys short and only ask pertinent stuff anyway, because young people just switch off and stop answering your questions. I work with age UK, as I say. Older people are really reluctant to answer questions if they think that they're not useful. That's why they get such a low response rate to their surveys anyway. So yeah, so I'll show you how to measure well-being.
Jason, Faith's asked a question. She says, we evaluate not anonymously. So how would you recommend you overcome that?
All evaluation I do is anonymous. You just don't take their name. But what you do evaluate is you sort of, as long as you know what kind of people they are. So what's important about the evaluation? Not their name, because if you think about it, whether they're called John or Mary or Ahmed, that doesn't make any difference to the data. You want to know whether they are their age, their demographic group, whether they've got a disability or not, depending on the service. So you want to know about them, but not necessarily anything that could be traced back to them. And bear in mind that when you do your evaluations, especially survey data, you're aggregating the results anyway. So that's not a real issue because you're doing it on averages, you know, especially I'll show you that in the last slide, the last section, when we look at how Mary measures her own services. Case studies are probably something a bit more important, but case studies should never be based on single accounts anyway, because the person could read that whether their name's been changed or not and recognize themselves. So what you do is you take 10 or 15 case studies and you amalgamate them, and then you look at common themes coming out of that rather than the individual accounts. Because an individual account, if you've got John's story and you actually did sit down with John and says, tell us about your experiences being homeless, John will tell you, and then that's only John's story. It's not generalizable. So from an operational perspective, you can only do something. It's like anecdote. There's not much you can do with it to change your business practices. But if you've got lots of Johns, you look at the common themes that John type people have and how you work with them, that tells you something much stronger, because you actually say, okay, well, I can see what we need to do now to meet that challenge. And that's a changing of your way you deliver your service. Okay, so anonymity is a given for me. We don't need their names. Well, actually, I get really frustrated when people write them on anyway in the surveys, because I think, you know, if you need a survey, you're going to say, you know, the percentage of people called John answer their questions like this, and it's like, well, that's just rubbish data, because then, you know, we're not delivering services to people called John. We're delivering services to people who've got particular challenges. That's the important stuff. Okay. Has anyone else got any questions? I'll push on then. And bear in mind, you'll get a 3-hour consultancy if you'd like it. So these are the kind of questions you can bring to that. So here we are. What Mary needs to know about methods. So Mary's got her measures, right? And now she needs to develop and be able to talk about the types of data collection tools that she's going to use in order to be able to collect data. And you can imagine it's going to be a survey, it's going to be focus groups, it's going to be interviews, those different ways of doing it. And it might be fun activities. I do a lot of work with young people who are under 5 and they can't read, so they're not going to fill out a survey anyway. So we do loads of kind of flip charts and story circles and stuff like that. So yeah, so what Mary will do here is also match the method to the vulnerability and the feasibility of getting data out of that group. Okay, so what does she need to know about method? Right, let's look at the question first. So this is where we are on the evaluation cycle. So the funder wants to know what outcomes you report. We've covered that, but now they're asking, how do you collect data? Right? So all those questions in that we need, and how do you monitor outcomes? I've brought these together a little bit. So all these questions now we can look at. So what are the questions about methods? Well, how do you monitor and evaluate the work you are delivering? It's a how question. How are the outcomes measured? Okay. Not what are the outcomes, but how they're measured. How will you measure the success of your service? Right. So there's 3 there, but you know, I can think of other ways of, if I was writing myself, I could come up with a much more extensive list. These are kind of, as I say, Henry Smith and other charities like that. So she's got to answer these. So let's see what she does. Right. So she needs an evaluation plan for getting data from the programs and the tools to do it. Okay, so the evaluation plan, let's say she's got a mentoring service. She wants to have a plan for doing mentoring evaluation. The tools that she uses, whether it's a survey or a focus group, and the questions are going to be tailored to the service itself and the feasibility of getting data out of the service. Here's an example. Age UK run befriending services. So you've got a befriender on the telephone talks to an old person who can't get out of the house and is really isolated and lonely. Okay, so how do you evaluate that? You can't ask the service user to fill out a survey because they're only on that call for 45 minutes to half an hour a week. And you don't want them to sort of spend that time filling out a survey, because it will make them feel worse than if they just had the call. The idea of that service is to get the call. So what did we do for that evaluation? We got the volunteer who has just ordinary competencies to fill out a diary over the course of a month, of what they talked to their older person about, and the kind of interactions they had, and what they thought about in terms of the observations about the older person, whether they think that call's having an effect and making that person happier, blah, 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 blah. Okay, that's the matching the evaluation data collection method to the vulnerability of the client. And Mary's going to have to do this as well. So this is how she does it. Developing an evaluation. So in order for Mary to answer the funder's questions, she has to decide how to collect data. And there are two broad options. And if you've heard all this, I'm just going to run through it. It's just technical talk, because I just want to, sometimes funders ask you do use a bit of technical jargon. So you've heard of qualitative and quantitative, I think, right? So the qualitative approach explores experiences of service users. The what is it like? Okay, so what is it like to be homeless and under 16? What is it like to experience domestic abuse? One of my clients is a DV client. They could also say, if you're in an evaluation, tell us how you've changed. It's self-reported data, but it's just, tell us how you've changed. What do you think you're able to do now? How have you benefited? So it's all down to user experience, okay? We're not measuring anything, it's just descriptive. They're reporting back to you. Quantitative, that's a difference that you've made. Oops. So that could be the pre and post intervention surveys, or it can just be one end of program survey and a follow-up survey 6 months later. But either way, if you want to measure something, you've got to have 2 data points. And it's usually through a survey or an assessment form. So qualitative and quantitative have different, different ways of collecting data. How does Mary decide? Okay, she does it this way. So she knows that there are different ways of collecting data for these different methodologies, right? So qualitative, it's usually focus groups, interviews, you report through case studies. You might, if they're young people, get them to keep video diaries on their phones, or you can do graffiti boards. You can make it more or less fun, okay? So it's that fun activities. It's quite informal in some respects, but what you're doing is getting people to tell you something about themselves, either verbally or just through a medium of kind of, as I say, flip charts on a wall. Quantitative is surveys and assessment questionnaires, right? It's not the fun stuff. It's the stuff that gets in the way and is quite disruptive, especially if you've got vulnerable clients, right? So how does Mary decide? Okay, so she asks herself 2 questions. 1, what do I want to know about my services, right? What am I going to do with the data? The first identifies the outcomes that she wants to see, what changes, what we're looking for, what do we want to know about the beneficiaries and how they've changed. And when you've got 8 outcomes, it might be that they're not all relevant to every service. So she can say it's that outcome, that outcome, that outcome. And I'll show you how she does that. What we're going to do with the data is interesting, because if she's going to do marketing, she doesn't want a bunch of stats, right? From surveys. She actually wants some case studies. She wants some vox pops. She wants to be able to tell, to get the user voice, the beneficiary voice in her marketing materials. If she's an operations director and she wants to say, how can we get a percentage improvement on what we're trying to achieve for older people or for younger people or people with mental health conditions, then she's going to need to have that assessment data, right? So the question is, when you commission your evaluation, that's the key thing that you kind of commission against. Or if you're doing it internally, that's how you would design your evaluation. We ask this because the data we get from a service tells us different things about it, qualitative and quantitative experiences versus kind of actual measurement and impact. So this is Mary's evaluation strategy. So she's going to do a bit of both, right? She's going to do what's called a mixed methods approach. And she's going to, because it's going to give her some data that she can use to improve the service, and it will give us some data to bring that service to life. So she's going to use a survey and focus group, and the survey will provide data on the effectiveness of the program. She's going to do it twice, one at the beginning and at the end, and I'll show you what the results look like in a made-up example in a minute. The focus group will enable her to find out more about the experiences of young people and look at specific aspects. So she does her survey, looks at the results, thinks, oh, that's interesting. I didn't expect to see that. Let's go and ask them in a focus group. Okay, so they're using them really closely together. So it's not like they're just 2 separate things. They're working together, right? And that will give her data that the funder wants to hear. And I'm going to show you now how she'd answer those questions. But first and foremost, I need to show you how to write a really good survey. Developing data collection tools. Okay. Remember that she's got 8 outcomes in it, or 7 outcomes in her outcomes framework. This is how you use an outcomes framework operationally in your organization to make your life really easy, although it does look a little bit complicated, right? So to be able to talk about, to do her evaluation, and then to have data, to be able to talk to the funder about what she's doing in terms of data collection, she needs a survey, a decent survey, right? And she needs a list of useful questions that she can ask in a focus group. So they need to be all about the outcomes that she wants to measure. So what she's not got is an outcomes framework and then just sits around with her colleagues and says, well, let's just think of some questions to ask. She's using the outcomes framework to decide what the questions are. And this is how she does it. So before she can do this, she has to develop indicators, right, for each of those outcomes. This is really important because it will make your life a lot easier when it comes to talking about impact. You've heard of a KPI, key performance indicator, right? So if you've got your delivery data, that's usually things like targets, like by Q4 next year, you've got to have delivered 10 workshops to 20 people. That's a KPI. These are quite different. These are questions of what you'd expect to see if your young people, in her case, are becoming more confident. Okay. So what she does for each outcome, she says, what does this outcome mean to youth employability? And then she says, well, what would we expect to see if it was being met? All right. And it puts it into a grid. And this is what the grid looks like. And hopefully it's not going to freak you out. It's more complicated than it looks. Gives us a set of indicators for each outcome. So what she does is she has a single outcomes framework for those outcomes for all of her programs in a central place, right? And it's kind of owned by the organization. So these are her outcomes. Remember these, including wellbeing, which we forgot. And this is her outcomes framework, right? Now, it's simpler than it looks. Across the top, you can see creativity, communication, relationships, and leadership outcomes that I just showed you from that audit. But then she says, with her team, what would you expect to see if young people are becoming more resilient? What would you expect to see if young people are becoming more creative? And she comes up with these statements. The young person should be able to do this. The young person should be able to do that, right? Imagine when she did this, she probably had a lot of these. She's rationalized them, kind of made it a bit shorter. And the reason she does this is because she's going to use the indicators to write her survey questions. And that means that the data coming into her organization is about the outcomes, and she can trust the data, right? And it will make her whole life a lot more easy, a lot easier. So how should she do this? Okay, let's take one of these. So these are the indicators going down, and she's got 3 for each. I've just put this in an example. You don't want to keep it too long. What this does is discipline you as well, because there's a difference between what you need to know in order to be able to do your work and what you want to know just in terms of going off and thinking about wider research. This is the need to know stuff. This is the bare minimum that your organization needs to know about service users in order to be able to report and put together decent evaluation framework plans. So let's take this outcome. The young person is able to manage their anxiety on a day-to-day basis. So that's an indicator for the well-being outcome that she's got. Okay, so one of the things you'd expect to see, they're improving their well-being, is that they're able to manage anxiety, right? And these might be young people from the care system, from the secure estate coming into employability programs. They might be looked after children or young carers. So they've got a lot of stuff to be able to deal with, and it might be making them anxious. So these inform her survey, right? So how do they do that? So let's take an outcome, well-being. Let's take an indicator. The young person can manage their anxiety on a day-to-day basis. That's what she'd expect to see. Then she just writes the survey question on the indicator, all right? It's really easy. She's got 21 indicators. So she's got a question bank of 21 questions that she can pick and choose whenever she puts a survey together. And it's quality control on data. But it also gives her the data to be able to talk sufficiently and coherently to the funder. I'll show you how she does this. Right. So this is how she writes a question, takes the outcome, looks at the indicator, and then what would you expect to see? Young people can manage their anxiety. She just writes a question. On a scale of 1 to 7, to what extent do you feel you can manage your anxiety on a day-to-day basis? All right. So she's got to that question for the survey just by matching it, writing it on the basis of the indicator. It's simple because what it means is that you can do this in advance. And then you can say, okay, from now on, everyone, if you're going to write a survey, these are your questions. You can pick and choose, 1 per indicator or 2 per outcome, but don't make them up yourself. You can add a satisfaction question and ask them if they love the service. That's the only thing we allow you to do. But that way, if it's a big enough organization, or like one of my clients is running 32 programs, so they had 32 surveys which would go in all different directions. So they couldn't aggregate the data to even see how well the organization was doing across all of its programs because it wasn't compatible. This way it is. Okay. So there's different ways of asking the same question as well. So this is Mary's survey. So she can ask it on a scale, on the scale of 1 to 7, or just yes and no. Can you manage your anxiety? What's the most difficult thing for you about managing anxiety? So you can just leave it blank for the service user to fill in. Tell us 3 things you do to manage your anxiety, whatever. Okay, how can we better help you to do it? And you think for each of those indicators, you can ask the same question in 5 ways. So you've got 7. You haven't had to think about it now. You can just do the survey writing. So that's how she does it. And she can do it face-to-face as well. So you do face-to-face if you want to do some participation work with your service users, for instance. But whatever you do in a face-to-face, it's still using those outcomes to guide the question, okay? And that's important because I've got this built into the model answer I'm about to give you. Some funders, I've said this, turn down bids if they don't demonstrate that service users have proper involvement in service design. So this face-to-face way is a good way of building that in as well. So let's imagine that Mary does this. What does it look like? Well, let's just take one. The young person is able to manage their anxiety. She sits them in the room, just says, tell us about your experiences managing your anxiety. How can we work better to manage these for you? It's a very open question, and they'll just talk. More likely, they'll just sit there stony faced until you start probing them. But yeah, you can basically get the data out that way. You might be writing notes, you might be recording it, whatever. Okay. That's an unstructured question, right? It's very good, but it's also open. And it means that you'll get a lot. It's like an open question, so it just means that Mary's going to get a lot of data and have to do something with it. And that's the stuff that takes time. So she might only want to limit the number of unstructured questions. She can ask the same question, however, in a slightly different way. We could ask, who here finds it difficult to manage anxiety on a day-to-day basis? Put your hand up, then probe. That's interesting. Can you tell us some of the ways this has been a challenge for you? So that's called, what should we be doing to help you? That's called a semi-structured question. Gives you a desire to evaluate a more focused data, but it might mean they've missed something important because they were basically guiding the question. That's fine. You could also ask, hands up if you've experienced the challenges managing your anxiety. Give us an example, right? If you do that, that's called a structured question. It's just like asking a survey question. If you're going to do that, get them to fill out a survey. Your life will be much easier. Okay, so you've got these 3 different ways of asking questions to your participants in focus groups or interviews, or kind of semi, user forums. So AQK, for instance, have a older people's reference group. We've done some work like this with them as well. So you've got these 2 different ways of collecting data: surveys, which is quantitative, and focus groups for her, which is qualitative. So how does she then answer the question? Now, I'm conscious that we're going to have a break in 3 minutes. Okay, so this is her model answer. So they ask, how do you monitor and evaluate the work we're delivering? She knows it's a methods process question. They're not asking, even now, they're not asking for results. Thinking about the qualitative and quantitative methodologies you're going to use. If you're going to use a survey, then or not, then this is the opportunity to tell the funder why. Because this question is telling the funder what data they're going to get back when they've given you the money, because the only return they do get is a data return, so they want to make sure it's going to be as useful as possible. They want to know how you use those methods. For instance, because service users are vulnerable or can't read, we're not going to survey, or too young, or are sight impaired, which is one of my clients. So what do we tell them? Right, so Mary tells them the methods that she's going to use to measure impact. We collect data through a basic survey. How it's administered. A baseline measure is taken at the start of the program and followed again after 6 weeks. How the methods work together. Our survey gives us an overview of our impact. We then use focus group discussions to explore which elements of the program works best and for who. So she's bringing them together. And this is her answer. So youth employability takes a mixed methods approach to data collection using a combination of surveys and group activities to explore the impact we have on young people using our programs. We administer a short assessment survey at the start of the program to measure participant progress, outcomes. This tells us how each participant develops over time in relation to their work readiness, which we measure as confidence and the ability to problem solve and develop workplace relationships, etc. For ethical reasons, these are vulnerable young people. We keep our surveys short, doing more in-depth evaluation in more informal group settings. In the groups, we encourage young people to reflect on program help, how the program helps them, etc. Okay, so that's how, just by having your outcomes framework and using that to develop the survey and then deciding what you want to know, what you're going to do with the data, that you've given yourself a framework to actually start thinking about what questions and how you're going to engage with your service users to be able to develop that evidence base. And at no point have you asked a satisfaction question or relied on, reporting outputs and deliverables. So you've got a break coming up, 5 minutes. We can
I just want to say one thing before we break. As many of you will know, and I know some of you on this call today have applied to some of the very large charities. I'm thinking particularly Henry Smith. And if you look at the Henry Smith guidelines, they will actually state in their improving lives and strengthening communities the outcomes they would expect to see in a similar box way that Jason has just illustrated, which informs you exactly, they've actually done the work for you in that sense. That's the outcomes they want if you apply for this funding successfully. So thank you for that, Jason. We're going to take a 5-minute break. Yes?
Yep.
Great. And then so we'll reconvene at 12:05 for the next session.
Brilliant. Okay, I shall see you in about, 4.5 minutes.
Okay.
See you in a minute.
Okay.
Right, we're just waiting for everyone to come back. So once Beverly's at her desk. Okay. Everyone here? Let's have a look. Is everybody here? Right. Okay, right. Let's just check this. Oh, yeah, Molly, you're back. That's good. Hello. Right. Let's wait for Bryony to turn up and then we will kick off. Is everyone finding it okay so far? Is anything that needs clarifying? Good, good. Okay, right. Let us now talk about what Mary needs to know about reporting impact. Okay, so we've gone through the measures. So Mary's now, she's got evaluation ready. She's got something to measure and some tools to develop the measures with. Okay, and we looked at how she's going to write her survey and then how she would use the data that she got from her qualitative and quantitative mixed methods evaluation to answer the questions that the funder had put together. Okay, and you know what the difference is now between qualitative and quantitative, because we showed you, we know the different types of data, and you know what you sort of need to avoid in terms of misreporting. So now that she's ready to do evaluation, what does she need? How does she talk about impact? How does she sort of talk about the difference she's made? Right. So let's go back to the funders' questions against our evaluation cycle. So we knew that they wanted to talk about outcomes. We had questions on data collection. Now we've got these questions on what success have you achieved and or how do you measure impact, right? So what are those questions? Please explain how you would collate, measure and report the benefits you describe. What difference do you make? How do you measure success? This is the only time I've ever seen this. How successful were you in meeting last year's objectives? Right, so they're asking specifically for some data there. Other ways of asking that are feel free to put in some statistics. I've seen that in the John Ellerman or the Lloyd's Trust bids recently. Please provide outcomes evidence from the work either you or others have delivered before to demonstrate that what you do is effective. And that's really important because they're saying if you haven't got any data, go online and find out some research about how your model is effective, because we'll accept that. If you're a startup or it's a new project and you're getting funding for something you haven't run before, they still want to know whether models like that work. It's a different way of reporting. We don't cover that here, but it's just to sort of, they still want you to be able to demonstrate that it works. Describe the impact you expect to make with individuals and communities and the difference your work will make to them. That sounds very much like the bid that you were talking about, Henry Smith. Okay, so we've got these different questions. So Mary wants to measure impacts, right? So she's got her survey, she's got her outcomes, but now she's got to collect data and she's got to do something with it to answer those questions. Not just report it. So what we're going to do here is take it a little bit again beyond what I've seen a lot of charities do. So one of my clients has got, funny enough, they actually spent 25,000 quid on the randomized control trial in 2015. It's a really big piece of work. It shows that their work is effective, but they don't know how to use it. So what they were doing is just saying, we've got a randomized control trial that we carried out in 2015, and it shows that our work's really good. But actually, it could say a lot more than that. So what we want to do here is show you how to use data to report measurement and and the difference you make, not just say we make a difference, right? So to measure the impact, you need to see the difference, right? And impact is about change. So she needs to see how much change she's generated or seen in her service users, her young people going through her work employability programs that she's surveying at the beginning and at the end after 6 weeks. So this is how she's going to use the data from those surveys to be able to measure change, right? And even what I'm going to show you isn't that sophisticated. I'm not going to talk about the different types of statistical tests you can put into place. I'm not even going to mention, apart from now, the issue of statistical significance, which you might know about, but we're not going to go into that. Because lots of charities just don't have that data, okay, because they've got small samples. But we're going to get you to the point where you can kind of use it a bit better. So much to think about. Yeah, I did a whole course on this for a year. It even drove me mad. So anyway, she wants to measure impact. Can she get the data? That's the first question. Okay, so it's a feasibility test. And that's down to the vulnerability of the older people that I work with. Some charities, the cognitive and the competencies of other service user groups. So can she get a pre and a post intervention measure? Is it actually feasible? Is the program long enough? Okay, so some of you might be running programs which are quite short or only involve you talking to a client or a member or a beneficiary for a short space of time. Give you an example. One of my clients is a domestic violence charity that offers a free 45-minute pro bono consultation with a solicitor. But it's only 45 minutes. There's no point serving at the beginning and the end to say how much better do you feel after the 45 minutes, because they won't have changed. They've still got to go home to the perpetrator. Their life hasn't. It's a start of their pathway to independent living and dealing with the issue, but it's not going to happen there and then. They might feel relieved that they're talking to a solicitor for finally. It might be that their well-being is off the scale, but that's just euphoria. Okay, which will soon wear off when they go home. Okay, so that's not helpful data-wise. So is it actually feasible? Can you do a follow-up? Age UK's advice line, I'm evaluating that, 45-minute consultation with a caseworker, but there's no way they can go back to the client 6 weeks later to see what's happened because they don't keep the emails. So yeah, so you have to think about the feasibility test when you're doing surveys. Yeah, note to self, tell them about the DV consultation, which I just had. 10 weeks, that's a good time, or 6 weeks. If you've got a 6-week program, or it's over a school term, if there's a tutoring program, yeah, you can do the beginning and the end. You can survey them once a term, or once every quarter, or every 6 weeks, or whatever, or just at the end of every program. In order to do 45 minutes in order to do measurement the way that I'm going to show you, you need to do the survey twice, at the beginning and the end, or at the end and a follow-up. Okay, if you're only going to do it once, it's a slightly different approach, and that way you probably focus more on the qualitative focus group side or the interviews. But it depends if you're only going to do one survey, this is important. What you can do is ask them how confident they are using what you've shown them when they're in the real world. And that's a good test of whether they feel that they've learned something. And that's the best you can probably do. Okay. Sue, Mary wants to measure impact. Let's assume she can, and it is 2 data sets, okay? So she needs 2 sets of data, and she needs assessment scores at the beginning, which we call the baseline, and she needs assessment scores at the end, which we call follow-up. So, and she needs this on all 7 outcomes. So she's got this question bank, remember? So she can now pull the questions together on each of those things, and that's how she's going to put her survey together to give her, and it's the same survey at the beginning and the end, and she's going to basically measure their impact. So 7 outcomes, she's got creativity, communication, relationship and leadership, resilience, confidence and agency, okay, planning and problem solving, right? And what's this? Okay, and she's going to do the first survey, and let's say just for ease, she's got 10 respondents. And also for ease, I'm going to imagine that the same people are there at the beginning and the end, right? So she hasn't lost any. If you've got 10 people at the beginning and 5 people at the end, because you've got significant drop-off, you can still do this. But that's when you've got, if you've ever seen in SurveyMonkey, this function called weighting, what that does is it works with the figures to make it look as if it had been filled out by the same people. We don't look at that here, it's too complicated. 10 again at the end and 10 at the beginning, okay? And I'm going to show you how she does it on just one outcome of well-being. Right, so remember that well-being question was a 1 to 7 question, which is what we're going to use for the example. First scores, so at the beginning of the program, she gives them the survey, and the 10 people rated themselves on well-being only, in this case, in the following way: 2, 2, 2, 3, 4, 5, 3, 2, 2, 1. You can see that on the whole, most people are rating their well-being quite low, except for 2 people in the middle who are misreporting properly. They're saying, yeah, no, we're fine, we're feeling really confident. And they've got a median score of 2. All right, so that's the average we're going to use for this. And second, at the end, 10 weeks later or 6 weeks later, look at how they're doing, right? So the 2s have all gone up to 5, 2, 3, 5, 5, 2, 3. And you get a lot of variability here. The people who were 4 and 5 are actually now 2 or 3. Now their confidence scores have gone down. And you can think about why that is, and you can look at that in the focus group or the survey and interview. One of the key things is here that when you're evaluating people at the beginning of a program, and especially young people, they often overscore themselves at the beginning. You know, they get into the program, they're meeting each other at the same time, they're all gung-ho, and they score themselves really high, which means when you do it again and they start to have a reality check, sometimes, they did this with the FOIA Federation, their scores had all gone down. Okay, so what do we do? So the rule of thumb is, good practice, don't fill out the survey in the first week when they're all settling in. Do it in week 2 or 3 if you've got the time on a longer program, because they've had time to kind of adjust to the setting and stuff like that. And you get a truer score. But people are always going to, this is a very subjective process. Okay, so people are always going to score themselves differently over time. And actually, if you're asking young people, they'll probably score themselves differently in the same day if you to ask them the survey twice as well. So we've got this median at the beginning of 2, median at the end of 5. Okay, and that's the evaluation score for the group, because we've got an average, right? We're not looking at it on an individual basis. Okay. So for each, we've done a pre and post assessment or intervention survey, and we find the following median increase on all of the outcomes. So creativity goes up by, can't see, it goes up by 3. Communication goes up by 2, so they're better communicators. Relationships and leadership have gone up by 4. Resilience, not so good, just 1. Confidence and agency 2, well-being has gone up by 3. That's the example. That's why it's in red. And then planning and problem solving by 2. Okay. Key thing on reporting data: don't be scared of your results. Okay. Here, resilience has only gone up by 1 in a 10-week program, but that's fine because they've got some real needs. These young people, they come from different looked after backgrounds. It might be that Mary says, look, we don't expect to see their resilience improve much within the program. It's only when they go into their work placement and their job at the end of it that it might see their resilience rise. So if you was to do a follow-up, maybe the resilience has gone up by 3-6 months later. But if you don't expect this is the feasibility issue. If you don't expect to see young people, in this case, improve in that period, tell the funder. Just say, we measure resilience, but we often don't expect to see that much of an improvement. That comes later. Okay. So how does she use this? So the first thing, just a quick, this came up in a call in a session when I last did this. People said, the question was, do we have to survey the same people both times? Okay, because we find it really difficult to keep touch with people, and if we do it in a 6-month basis in our centre, it might be a different set of service users. So the idea is, so for this, in this case, in this example that I was asked, it's quite informal day setting. It's like a community centre. She says people can turn up when they want, so we've got no guarantee that we'll have the same people to survey at the end of it. So the question is, can we do it to different people? Yes, you can. It tells you something slightly different. If you do it to the same people at the beginning and the end, that's called a panel study, because the people are the panel, and that will tell you how each person matched to their 2 scores has done over the course of the time that you've been with them. If you do different people, it's called a trend study. It's still valid. You can still look at the before and after. You can look at the impact of going into the day centre or the community centre for groups of people, and you can ask them how long they've been coming. But it just tells you the trend that you're achieving rather than how specific people have done. Okay, so that's just in case you don't have any control over your service users. We're going to use a panel, so we're just going to assume that the same people are there at the beginning and the end. So she can now tell the funder, we measure young people's progress through, it's going to hide that, through the program using a pre and post intervention survey against 7 outcomes. For each of these outcomes, we observe a positive effect, with the young people reporting an improved ability to communicate, be resilient, make decisions confidently, etc. She can tell them the size of the effect. This is the important bit. So up to point 2, she can just says, look, we've seen this effect. We know that it's good and it's a positive effect we have. Now she can say, because she's done the work with the stats, we can tell, she can say how big the difference she makes is. Okay. So we have a strong track record of building young people's confidence, resilience, planning and problem solving, etc. with scores generally raising from an average of 2 at the start to 5 at the end, and then she'll repeat that for other outcomes. She's telling them how big the effect is. We further explored the impact of our programs through focus group discussions with young people. They tell us, and this is where you can put a quote in. So normally I don't like quotes taken completely out of context, for the reason that you're never going to put a quote in that says, this is rubbish, I don't like it, I'm never coming back. Funders will say it's self-selecting and you're going to tell the good. So, and that's for understandable reasons. So here, you can use a quote because it's basically in the context of the reporting that you've already done. And this is from the focus group. So they tell us, I found the workshops helpful in building my self-confidence. When I came to youth employability, I was really unconfident and didn't feel I had any useful skills. Being in the program showed me that I can do what I want if I put my mind to it. Okay, so it's a quote that helps to bring to life together the data from the survey, which admittedly is quite flat and quite dry. So they ask, what difference do you make? How do you measure success? How successful were you meeting last year's objectives? So that's a question, is asking for impact. What else? They want to know the general information about the impact measures you use. This is what we measure, and this is the difference we make and how they relate to the service. Okay, this brings in the different types of data together. So in this case, you've actually got a little bit of deliverables data, a little bit of engagement, and a little bit of impact. And I'll show you how to answer that now. So we tell them what measures we use, outcomes and indicators, what behaviour change we saw in our last evaluation, and how the service promotes it, what delivery looks like. So we deliver workshops over a 10-week period. Young people in the programme for 10 weeks, meet weekly with their key worker, and why this is important. And why it matters to the service users. Service users find this useful as an approach because it allows them to dress their whatever. So this is the answer. We evaluated our programs over the year 2021 to 22, administering a baseline and follow-up survey to 36 people and holding 4 group sessions each with 9 young people. Overall, our programs increase young people's work readiness against all 7 of our outcomes, with over 70% of program attendees reporting an increase in their confidence, ability to plan and problem solve, etc. And you'll do it for the whole outcomes. Through the group sessions, young people told us that I've got people's heads in the way now. I've got to look at that. Our one-to-one support and workshop approach was important in allowing them to focus on work-related tasks and prepare themselves for employment. One young person told us, again, we can bring another quote in my family, there is no history of working for a living. Without youth employability, I don't think I'd even see myself going to work. The programme and the caseworkers have been really important in helping me to set goals for myself. And then that's it. That is it, in fact. Okay, so that's the model answer. Okay, so you've gone through this process. Okay, so you've got your outcomes. You use your outcomes framework to develop your surveys and your tools. You can talk about that now, and then this is how you would use data from a pre and post test, mixed methods intervention, evaluation of a program that in this case runs over 6 weeks. And I'm sure that you have questions on how to apply this to your own work. It is applicable. This is just a kind of quite general evaluation example. But I wonder, has anyone got any questions? It is now 25 past. So as soon as everyone's run out of questions, we can go. I'll stop sharing at this point so I can see everyone's face. Okay, who's first, if anyone?
Questions, anyone?
Laura, you're on mute. Oh, no. But we can't hear you.
Can you hear me now?
Yes.
Yes.
Oh, right, fine. Sorry. It's really about statistical significance, which I realise is a bit of a knotty question. But in that example you just showed, you had resilience going up by 1 point, yeah. Which was 1 point, say, on a 10-point scale. And then in her reporting back, she put that they'd seen increases in all these measures, and that included resilience. You know, obviously, it's very complicated to do statistical testing on all this stuff and that, but how do we approach that? I mean, what can we with confidence say? Because it could be a little bit, well, if it went up 0.5, do you still say it's an increase?
Well, it wouldn't go up 0.5 because you're measuring, unless it's on an average, but that's if you
okay, yeah.
it would stay half, it would stay in whole numbers. But So there are two different types of statistical tests that you can run on the type of data that comes out of the survey. One is difference between groups. So do boys do better than girls? In your survey, you'll say, tell us your gender, or how do you report your gender? And if it's binary enough that there's just boys and girls in the room, and they self-report that way or self-identify, then you've got two groups, and you can look at who's more confident at the end of the 6 weeks, all right? And the other type of test is a test of association. What's the relationship between being in the program and over the 6-week period and the outcomes that you're measuring against? So for instance, confidence. And the tests for the first one look at, let's go back to what statistical significance is. So when academics report it, it's basically a measure of the likelihood that your results are just down to either chance or luck, or what's in the world. So it's usually down to things like sample size and the way that you've put your, the way that the scores have been filled out at the beginning and the end. So if your scores are wildly varied, if the scores are, if there's, sorry, I'm just thinking about the best way to do this to lay people. But if you've got wildly varying scores in your first survey compared to your second survey, it probably won't be statistically significant, because all that the test will do is say, what's the likelihood that these two bits of data came from the same sample? And if the scores are all over the place, it will just say, well, actually, there's a big risk that these are just two different groups, and it won't be statistically significant. But all that tells you is actually it could just be down to chance that the difference, rather than down to anything that you've done. It gets complicated when you think about the way that you ask questions. So there's 1 to 7 questions. You can only do very weak tests on those to look at the difference between groups, or the difference or the correlation between intervention and the outcome. And they tend not to be statistically significant with small samples anyway. So you need some numbers behind it. If you wanted to do some really sophisticated modeling, let's say you wanted to use a well-being scale, do some proper well-being work, and you had a clinical validated well-being tools assessment tool to hand out at the beginning and the end, like the one I keep forgetting the name of, the Edinburgh Waverley Edinburgh. That doesn't ask questions in the terms of 1 to 7. It might ask questions in a ratio way, but it might be 0 to 100, for instance, or it might be, but you'll have to have it, but it'll be on a kind of what's called interval ratio data. And then you can do some really sophisticated modeling with that to look at whether or not whether there's a relationship between the work that you've done and the outcome, but also how strong the relationship is between the work that you've done itself and the work and the difference that you've seen. So you get some attributability. I don't think you'll ever do that for funders, because funders aren't going to ask you whether your service is significant. The only way you'd ever do it is if you either get a really keen master's student who wants to show off, or you commission a piece of work from like Ipsos or someone like that, or an academic organization, because they'll report it just as a sort of bread and butter sort of stock in trade. But it tells you from operations perspective, if you're running the service, that it's you making the difference. It gives you that confidence. So for instance, with this randomized control trial, which I was talking about for my other client, Life Skills Education, they're only statistically significant for the outcomes they're measuring against when young people are in schools. What that tells them, they're still having a positive effect, but it's still, the effect's still there. They just don't know in 4 cases whether it's down to them or something else. So it could be because there's something else going on in their lives, or it could be because they're in touch with another charity. Okay, Nicole, thank you very much. So yeah, so I wouldn't bother about it. It's there if you wanted to do it.
Okay, so I'm taking out of that, thank you, is that actually in terms of information for funders, shouldn't worry about that, and the fact that if consistently we always see like improvement, even if it's only like small improvement, then we are seeing an improvement. Yeah,
just say there's a point, because what you're doing is you're describing what you're seeing rather than measuring it in any real technical sense. I don't know any charity that actually would want to do that unless they're putting out a publication to, if they're a think tank and putting out a publication which they want to give other people confidence in the data. But for your purposes, you don't need to go that far.
Thank you.
Bryony had a question.
Yes, Bryony, sorry about that. I just see your hand.
No, that's okay. Mine is quite specific. I'm from Home Start, and children in need really want us to be able to measure the difference we're making for babies and very young children. this might be something for a free hour, I think, but I would like some clever ways of how we can say, yes, we have made a difference to these really small babies, basically.
Okay, observational for that. So one of the things, I got a background in this just through, it was one of the areas that I picked up when I was doing my master's degree. But there's something, so when you're doing work with very, very young babies, especially when it's with their mothers, you're looking at the interaction between the mother and the baby. It's called a dyadic interaction. And what you need to do is put together a checklist, and then you just watch these babies with their mothers, and you say, okay, the number of times they get eye contact in an hour, and how they play with them, the interaction, and the time they spend playing with them. There's a lot of academic study on that, so you could put together a really good set of observational tools. What you wouldn't do is survey you could survey the mother to say, how confident do you feel in terms of being able to sort of talk to your baby? Do you feel you've got the parenting skills? What don't you feel? But if they're in the program anyway, you've probably done that assessment. They wouldn't be there if they didn't have them anyway. Yeah. So it's quite a low parenting baseline. So what I would do is look at that kind of interaction. It's observational for that. In the same way, you can also do the diary approach. Just keep a diary of how you look after it, play with your kid over the week, and make sure it's honest, and back it up. If they say, I basically play all the time, then they just ignore them and are on their phones when they're in the centre. You knew that something was going wrong. Actually, the time of how easily distracted is the mum? That's another. You want to basically, presumably, get the mum to do more work with the baby, right? So they're actually nurturing them and stuff like that. Actually, smoke in its face is one key indicator that I think would be quite useful to see. I've seen that actually quite recently. I had to say something. So anyway, yes, that's what I would do there. It's doable, but I mean, that's when you do a purely qualitative approach. It's almost like ethnography, the kind of thing that anthropologists do, sit there just watching people do stuff. But you need to have a framework so you can basically set your observations against a framework.
Yeah.
Okay.
Thank you.
Other questions for Jason?
No more? Get in touch and have your free hour, and I'll basically talk you through your bits and pieces.
Do you want to just talk, Jason? I'm going to stop recording now. Do you want to talk about the follow-on service a bit?
Oh, yes. Okay.
Stop recording. Hang on.